Have you ever wondered why sometimes you might urinate less than usual? It's not just about how much water you drink. Welcome to an exploration into the realm of the human body and its functions. Today, we delve into a topic that might make a few of us uncomfortable, but is crucial to our understanding of our body's health. We're talking about decreased urine output, more formally known as oliguria. Urine output isn't something most of us think about on a daily basis, but it's a vital indicator of our body's hydration and overall health. Under normal circumstances, an adult should produce about 1.5 to 2 liters of urine each day. That's roughly 6 to 8 trips to the bathroom, assuming an average bladder capacity of approximately 300 milliliters. But what happens when you notice a distinct drop in this output? It's not always a cause for alarm. The amount of urine we produce can fluctuate based on various factors, including our fluid intake, the temperature, and our level of physical activity. However, a significant and consistent decrease in urine output could be an indication of underlying health issues. These can range from simple causes like dehydration to more complex conditions such as kidney disease or bladder disorders. Even certain medications can lead to a decrease in urine production. Understanding this, it becomes clear that maintaining a healthy urine output is about more than just quenching your thirst. It's a balance of proper hydration, regular physical activity, and a keen eye on any changes that might signal a deeper problem. As we delve deeper into this topic, we'll discuss the common causes of decreased urine output, the effects it can have on the body, and why it's something you should be aware of. Whether you're a medical student brushing up on your knowledge, or just someone interested in understanding your body better, this discussion will shed light on an often overlooked aspect of our health. Understanding the causes and effects of decreased urine output can help you recognize when something might be amiss with your body or a patient's body. One of the most common causes of decreased urine output is dehydration. Now let's dive into what that really means. Dehydration occurs when your body loses more fluids than it takes in. This imbalance disrupts the normal metabolic processes in your body, which in turn can lead to decreased urine output. But how does this happen? Well, let's think about it. Our bodies are like finely tuned machines, with each part playing a specific role. The kidneys, for instance, act as filters, removing waste products and excess substances, including water, from our blood. This waste then becomes urine, which we expel from our bodies. However, if the body doesn't have enough fluids to function properly, the kidneys may conserve water, leading to less urine production. Lack of fluid intake is a simple yet significant factor that can lead to dehydration. This could be due to not drinking enough water throughout the day or losing large amounts of fluid from sweating, especially during intense physical activity or hot weather. Even a high fever can cause you to sweat excessively, leading to fluid loss and ultimately dehydration. Illnesses that involve vomiting or diarrhea can also cause rapid fluid loss, leading to dehydration. The body loses not only water but also vital electrolytes, which are crucial for normal body functions. This situation can quickly escalate and cause decreased urine output, among other complications. It's key to remember that while dehydration is common, it can be serious, especially if it's not promptly addressed. Chronic dehydration can lead to kidney stones, urinary tract infections, and in severe cases, kidney failure. However, it's not all doom and gloom. Dehydration is preventable and treatable in most cases. You can prevent dehydration by drinking plenty of fluids, especially when it's hot, when you're physically active, or when you're ill. So, dehydration is a simple but common cause of decreased urine output, but it's not the only one. Stay tuned as we explore other potential causes in our next segment. Now let's dive into some more serious causes, kidney and bladder conditions. Firstly, let's talk about kidney stones. These are hard deposits made of minerals and salts that form inside your kidneys. They can cause severe pain when passing through the urinary tract and, in some cases, may block the flow of urine, leading to decreased urine output. Next on our list is kidney failure. This condition refers to the kidney's inability to filter waste from the blood adequately. In acute cases, this failure happens rapidly over a few hours or days, while chronic kidney failure progresses more slowly. Both situations often result in a reduction of urine production as the kidneys can't adequately remove toxins from the body. Urinary tract infections, or UTIs, are infections that occur anywhere along the urinary tract, including the kidneys, bladder, and urethra. These infections can cause a variety of symptoms, including a strong urge to urinate but passing only small amounts of urine. The inflammation caused by the infection can decrease the bladder's capacity to hold urine, thus diminishing urine output. Additionally, bladder conditions such as bladder stones, bladder cancer, or an overactive bladder can also lead to decreased urine output. Bladder stones are hard masses of minerals that form in the bladder when it's not completely emptying when you urinate. Similarly, bladder cancer can cause a decrease in urine output due to the tumor obstructing the flow of urine. An overactive bladder, on the other hand, results in frequent urination in small amounts due to involuntary bladder contractions. It's crucial to understand that these conditions are often accompanied by other symptoms such as pain, discomfort, changes in urine color, or a fever. If you experience any of these symptoms, it's important to seek medical attention promptly. These conditions are more serious and require medical attention to address. You might be surprised to learn that certain medications can also affect your urine output. This might seem strange at first, but when we delve deeper, it becomes clear how this can occur. Let's start with diuretics, a type of medication that helps rid your body of salt and water. They work by making your kidneys put more sodium into your urine, and where sodium goes, water follows. This process increases your urine output, which may seem counterintuitive. However, over time, this increased output can deplete your body's water levels, leading to dehydration and, ironically, a decrease in urine output. Next, we have high blood pressure drugs, including ACE inhibitors and angiotensin II receptor blockers. These medications help relax and widen your blood vessels, allowing blood to flow more freely. But here's the catch. By altering the blood flow in your kidneys, these drugs can potentially decrease the amount of urine produced. And then there are non-steroidal anti-inflammatory drugs, or NSAIDs for short. These are common over-the-counter medications like aspirin and ibuprofen. They work by blocking enzymes that produce chemicals called prostaglandins, which trigger pain and inflammation. But prostaglandins are also involved in maintaining the blood flow to your kidneys. By inhibiting these enzymes, NSAIDs can reduce kidney function, leading to less urine production. It's important to note that these side effects don't occur in everyone. They're more likely in people who already have decreased kidney function or who are taking other medications that affect the kidneys. So, if you're taking any of these medications and notice a change in your urine output, don't panic. It may be a side effect, or it may be something else entirely. The key takeaway here is to stay informed. Understand what medications you're taking and how they might affect your body. If you have concerns, talk to your healthcare provider. They can help you understand the risks and benefits of your medications, and they can work with you to manage any side effects. Always be aware of the potential side effects of any medication you are taking. Knowledge is power, and in this case, it can also mean better health. Decreased urine output is not just a symptom. It can also lead to various effects. Let's dive into the physical discomfort associated with decreased urine output. Imagine, if you will, a feeling of discomfort in your abdomen. This is often one of the first signs that something is not right. For some, it may feel like a dull ache. For others, it could be a sharper, more persistent pain. This discomfort is usually accompanied by swelling, which can be visibly noticeable and adds to the overall physical unease. But the discomfort does not stop there. Decreased urine output can lead to a general feeling of being unwell. You might experience fatigue, dizziness, or even nausea. These symptoms can be debilitating, affecting your daily routines and overall quality of life. Now, physical discomfort is one thing, but decreased urine output can also be a sign of serious illness. It can be an indicator of kidney diseases like acute kidney injury or chronic kidney disease. These conditions can have long-term health implications if not managed properly. In acute kidney injury, for instance, the kidneys suddenly become unable to filter waste products from your blood. This can cause dangerous levels of waste to accumulate, disrupting your body's chemical balance. Chronic kidney disease, on the other hand, is a long-term condition where the kidneys do not function as well as they should. It's a gradual process, but over time, the damage to the kidneys can become severe. Furthermore, decreased urine output can be a sign of heart-related conditions. In some cases, it could indicate heart failure, where the heart is unable to pump blood around the body effectively. This can lead to fluid buildup in the body, which in turn reduces urine output. If you or a patient experiences decreased urine output along with other symptoms, it's important to seek medical attention. After all, understanding the signs early and seeking the right treatment can make all the difference in managing these conditions effectively. Chronic decreased urine output can pose long-term health risks. It's not just a matter of discomfort or inconvenience. When the body isn't able to eliminate waste and excess fluids properly, serious complications can arise. First off, we have kidney damage. The kidneys are our body's natural filtration system. They work tirelessly, day in and day out, to cleanse our blood of toxins and send them out of the body through urine. But when urine output decreases, these toxins can start to build up. Over time, this toxic overload can damage the kidneys, impairing their ability to filter blood, maintain electrolyte balance, and regulate blood pressure. Then there's chronic kidney disease, or CKD. This is a progressive condition where the kidneys gradually lose function over time. CKD often stems from conditions that put a strain on the kidneys, like high blood pressure or diabetes, but decreased urine output can also be a contributing factor. When urine output is consistently low, it means the kidneys aren't working as efficiently as they should be. This can put extra stress on these vital organs, potentially accelerating the progression of CKD. And let's not forget, CKD can lead to end-stage renal disease, a condition requiring dialysis or a kidney transplant. Furthermore, decreased urine output can increase the risk of urinary tract infections. When urine isn't expelled from the body regularly, it can create a breeding ground for bacteria. These infections can be painful and, if not treated promptly, can spread to the kidneys, causing further damage. Lastly, there's the risk of kidney stones. These are hard deposits of minerals and salts that form inside your kidneys. Decreased urine output can lead to concentrated urine, which is more likely to crystallize and form these painful stones. In conclusion, chronic decreased urine output is not just a minor health concern. It can pose serious long-term risks, including kidney damage, CKD, urinary tract infections, and kidney stones. So, decreased urine output isn't something to ignore. It could be a sign of serious health issues. So, we've explored the causes and effects of decreased urine output. We've learned that it's not just about feeling uncomfortable or needing fewer trips to the bathroom. This could be a sign of something more serious, such as dehydration, kidney and bladder conditions, or even side effects from certain medications. The physical discomfort and illness that can result from decreased urine output should not be overlooked. But more importantly, the long-term health risks associated with this condition are significant. From kidney damage to potential heart and blood vessel complications, it's clear that maintaining healthy urine output is crucial to our overall well-being. In sum, decreased urine output is more than just a minor inconvenience. It's a potential health concern that deserves our attention. By staying informed about our bodies and vigilant about any changes, we can take active steps towards maintaining our health. Remember, when it comes to your health, knowledge is power. Stay informed, stay healthy.